In this video, I just want to take you through some of the major abdominal blood vessels visible on a CT angiogram of the abdomen. And as we make our way down through the abdomen, we'll identify some of the other major structures as well, but we are going to primarily focus on the vessels. So we're starting right at the bottom of the thorax, actually, in this view, and you can see these huge great black expanses of the air-filled lungs. Here in the center of the screen is the heart filled with contrast, and we can also see speckled within the lung fields the pulmonary arteries and their branches filled with contrast. Also note, here we can see the thoracic vertebrae articulating with their respective ribs. And prominent on the left-hand side, filled with contrast, is the thoracic aorta. The first thing that we'll do is we'll follow the aorta down. So just keep your eye here on the aorta on the left-hand side. So we're following it down now. You can see it remains on the left, closely applied to the spine, gradually becoming more anterior. And as we enter the abdomen, we start to see some branches emanating from it. And then when we get down towards the pelvis, in this scan, something interesting happens, because here we see a huge gross dilatation of the aorta, and this is an abdominal aortic aneurysm. Okay, so you're looking at an abdominal aortic aneurysm now, and you can see that it's quite a big one. And we're starting now to head down towards the pelvis because we can see the pelvic bones appearing in the section. As we continue to move down, we get closer to a point where the aorta bifurcates. So here is the bifurcation of the aorta, and then it splits into the left and right common iliac vessels. So we've followed the aorta down, we've identified that. If we go back up to approximately this level, there's the aorta that we identified on the left, and we see on the right is the inferior vena cava. And they maintain that very simple relationship between the two structures, that the IVC is on the right and the aorta is on the left. And I always remember that, in that the aorta comes from the left ventricle, and the IVC drains into the right atrium. So that's how I remember their relationship. Now let's go back up to the top of the abdomen once more and just identify some of the other major abdominal viscera. So we move down, and this grey area here is the diaphragm, the right dome of the diaphragm going into the liver. So we're now moving down, and quite shortly we should be able to see the liver coming into view. So this is the liver, and we can see the occasional contrast filled vessel within the liver parenchyma. So moving down through the liver, we now see starting to come into view the gallbladder here, slightly darker on a CT. And continuing to move down, we see that sitting rather close to the liver is some gas-filled bowel, and this will be the hepatic flexure of the large intestine. And as we follow that down, we see that it connects with the transverse colon here, and of course the ascending colon here. And then on the left hand side, where we had the spleen on the right, where we had the liver on the right, we have the spleen on the left. So here is the spleen on the left, and the spleen sits very close to the splenic flexure. The splenic flexure of the large intestine connects to the transverse colon and continues down and towards the pelvis as the descending colon. So here's the descending colon going down towards the pelvis, and ultimately we'll see that descending colon entering the pelvis and becoming the sigmoid. So we've identified the liver on the right with the gallbladder, and we've identified the spleen on the left hand side. The other major viscera that we can see is the stomach. So here's the stomach with its greater curve and its lesser curve. And if we go to a slightly lower section, as we said before, we have the transverse colon. And sitting deep to that transverse colon in this view, we have the pancreas. So we've identified our major abdominal viscera. Now let's look more closely at the three major branches of the abdominal aorta going to the gut, as well as some of their other important branches. So going back up towards the top, follow the aorta down and let's look for its first branch. So I'm going down quite slowly here, and you should see the first branch of the aorta just starting to appear, coming off of it at this level here. So here is the first branch coming off of the anterior side of the abdominal aorta, and this is the celiac trunk. Now I'm going to move the slices up and down, and I want you to follow what happens to this blood vessel. Okay, we're going to be moving up and down because obviously the vessels are moving in 3 dimensions, but you need to follow this and keep your eye on the contrast filled vessel to watch what it does. So you can see the vessel here is remaining within the view as I move up in this case, and at this point we can see it splits. So at this point here you can see that the celiac trunk has split into 2 vessels. One is heading to the right towards the liver, one is heading to the left towards the spleen via the pancreas. So let's follow these vessels. Okay, looking at the one on the right to begin with. So follow it, it's going towards the liver, and we can see it branching in the liver there. The one that we followed to the right hand side was the common hepatic artery. Okay, going towards the liver. And I'm not going to talk about the other branches, although they are visible on this, but you can follow the further branches of the common hepatic artery as it heads towards the liver on the right hand side. On the left hand side we have the splenic artery. So once again, watch this white blob here and watch it join up with this white structure here. Okay, so here we are. Here we can see the splenic artery, and very, very nicely at this end here we can see the splenic artery splitting into many, many branches going in through the hilum of the spleen. And furthermore, that splenic artery, as it passes by the pancreas, sends off lots of pancreatic branches, which are actually quite small in this case, feeding the pancreas with a rich blood supply. So we've seen the common hepatic artery and the splenic artery. Now, as you might know from your reading and lectures, the celiac trunk also has a third branch, and that third branch is the left gastric artery. Now let's try to find this left gastric artery, and in order to find that we need to find the stomach. So here is the stomach and here is its lesser curve, and we know that the left gastric heads towards the lesser curve of the stomach. So let's see if we can find that. All right. So there we are. Now let me just point it out to you. So here is the point at which the celiac trunk splits into 3. Common hepatic, splenic, and here is the left gastric. Now let's just follow it and see where it goes. So watch that little blob there and see the direction it goes in. And look, it's going towards the lesser curve. So at this point here we have the left gastric heading towards the lesser curve. So those are our 3 branches of the celiac trunk. Now let's continue to move down. So there's the celiac trunk there. If we move down, almost immediately beneath it we should find the superior mesenteric artery. So there's the superior mesenteric artery there. and we should be able to follow that moving down through the sections. So just watch what happens. It will become a blob which will then move and split into multiple smaller blobs as it is distributed to the midgut through the mesenteries. So just watch what happens to this region here. We can see now the superior mesenteric artery is descending down, and then splits into many smaller branches which go on to feed the midgut. So that's the superior mesenteric artery that we've just taken in. What about the renal arteries? Well, we can get a nice view of those here. So here's the aorta, and here is the right renal artery, just there, going towards the right kidney. You can see that quite nicely there. And furthermore, we can see the right renal vein draining into the IVC. On the left, let's try and find the left renal artery. Here's the left renal artery. And then here is the left renal vein, just in front of it. So there's the left renal vein there. And very nicely on this scan, we can see that left renal vein draining into the IVC behind the superior mesenteric artery. The final branch we need to find is the inferior mesenteric artery. And the trouble here is actually the inferior mesenteric artery in this patient is coming off of their dilated aorta at the level of the aneurysm. But I think we can just about see the inferior mesenteric artery coming off the aorta just about at this point here. So if we follow this little blob here, we should see it descending down on the left hand side and splitting into branches feeding the hindgut. So let's see if we can follow it down. And yes, you can see it there, splitting into these branches, feeding the hindgut structures. So there you go. There's the inferior mesenteric artery. Now what we can do is we can actually segment out these structures filled with contrast and get a 3D view of them. So let me show you what a 3D view looks like. If I just go on to the 3D view here, we can see a segmentation that I made earlier showing the major branches coming off of the abdominal aorta. So here's the abdominal aorta, here's our big aneurysm down here, and we can see the various branches. We can see the celiac trunk coming off here, and we can see the splenic artery heading to the left, and the common hepatic artery heading towards the right. We can't see the left gastric very clearly, although if we zoom in, we can actually just about see it very slender just at that point there. There's the left gastric. Beneath the celiac trunk, we have the superior mesenteric artery descending and splitting into its various branches to the midgut. And we've got the renal arteries coming off just here. Finally, at the level of our aneurysm, we can see the inferior mesenteric artery at this point, going down towards the left hand side to supply the hindgut. One thing that you should note is that the vessels are not coming off at the classic levels that you might have read about in the textbooks. These vessels are actually coming off a lot lower than you might see written in the textbooks, and this is probably down to the distortion in the anatomy created by this aneurysm. That's all I've got to say about this. Thank you very much for listening.